Hello everyone. Uh, Myself Abhinay Botle. I am student of second year MBBS DUPMC. Here we will see about anticholinergic drugs. Under that, what are ganglionic blockers and what are the ganglionic stimulants. So in this first slide, we all see this is Atropa plant, Atropa belladonna, also called as Dhatura, which is anticholinergic drugs. So here some anticholinergic drugs and their uses. Scopolamine, which is used in motion sickness, ipratropium and tiotropium bromide. Tiotropium bromide used as a bronchodilator in COPD and bronchial asthma. Then benztropine and triazepam used in Parkinson disease. Then tolratidine, dorifenacin, solifenacin, oxybutylin used as a uterine relaxant agent. Here, ganglion. Ganglion is a nerve cell cluster of group of nerve cell bodies located in the autonomic nervous system and sensory system. So, what is anatomy of ganglion in the peripheral nervous system? So, where ganglion is located at the segment of spinal cord, where the dorsal root of ganglion, from which sensory and motor nerves arises. Here all of you can see sensory pathway, which is described by the red arrow, and motor pathway described by green arrow, which shows the transmission of signal towards and away from the spinal cord. So what are the drugs which acts on the ganglion? Two types of drugs acts on the ganglion, either by stimulating or by inhibiting. So by stimulating, there are two ways to stimulate the ganglion. First by nicotinic action and second by muscarinic action. So what are selective nicotinic agonists are nicotine, lobelin, DMPP, TMA, varenicline. And what are the muscarinic agonists? Muscarinic agonists are acetylcholine, carbachol, pilocarpine, anticholinesterase, etc. Then ganglion blocking agents. There are two types: competitive blockers called quaternary ammonium compounds, amines, and monosulfonium compounds. Second, persistent depolarizing blockers are nicotine and anticholinesterase. Nicotine under small dose, it stimulates the ganglion, and this nicotine under large dose acts by inhibiting the ganglion. Same goes with anticholinesterase. Ganglion stimulant. What is ganglion stimulant? The agent that mimics neural transmission by stimulation of nicotinic receptor on postganglionic autonomic neurons. Example: nicotine, lobelin, varenicline. Here are some structures of nicotine and lobelin. Next, as we see earlier, same. So as shown in this video, whereas neurotransmitter acts on the postsynaptic vesicle and cause release of neurotransmitters like acetylcholine, and which triggers release of sodium depolarization takes place, and from where it's calcium ion influx takes place, and which cause the contraction of skeletal muscle. Another action, activation of nicotinic receptor on the cells of adrenal medulla, which cause exocytotic release of epinephrine and norepinephrine. Then treatment of smoking cessation or quitting tobacco chewing. Majority of smokers wish to quit smoking but fail to do so because of nicotine dependence. So what are the measures for this purpose? Person can cease their smoking either by counseling or motivation. So in pharmacotherapy, what are the goals for cessation of smoking? To reduce the craving of satisfying effect of nicotine. Second, to suppress the physical withdrawal symptoms of nicotine. For this purpose, we use nicotine replacement agents and antidepressant like bupropion. In this picture, we will see nicorette gums, which help to reduce the dependence of nicotine. Second, nicotine transdermal patch, which release 7, 14, 21 mg nicotine per 24 hours respectively. In smoking, more than 20 cigarettes per day starts with 30 cm square patch, shift to smaller patch every day 5 to 8 days, and treat for 3 to 4 weeks, maximum 12 weeks. So first we will start with 30 cm square nicotine patch, which release maximum dose, and from this we shift it to the minimal doses. So by this method we will reduce the dose of nicotine and we achieve our goal for smoking cessation. What is ganglion blocking agents? Ganglion blocking agents that inhibit the transmission between preganglionic and postganglionic neurons in the ANS, often by acting a nicotine receptor antagonist. So here blocking agents inhibit the transmission of signals, which blocks reflexes and blocks predominant tone. Next, classification. What are the ganglion blocking agents? Competitive blockers, as we see earlier, monosulfonium compounds, and persistent depolarizing blockers. What are the mechanisms of action? Ganglion blocking agents acts by inhibition of anticholinesterase, inhibition of release of acetylcholine. Agents are botulinum toxin, hemocholinium, and magnesium ion. Second, non-depolarizing blockers are hexamethonium, mecamyelin, trimethophan, used historically for treatment of hypertension. Depolarizing blocks are occur when receptor is persistently depolarized by nicotine agonist and result in decreased electrical excitability of postsynaptic cell. In this picture we will see ganglion blockers acts on NM cholinereceptor, which blocks the transmission of postganglionic cell. Indication. What are the indication of ganglion blockers? Used in malignant hypertension, neurosurgery to control hypotension, orthopedic surgery to control hypotension, and autonomic hyperreflexia. What are the side effects? In CVS, it causes orthostatic hypotension with or without reflex tachycardia. Second, in GIT, it causes constipation. Third, sexual dysfunction like male impotency, which is occurred due to failure of erection and ejaculation. In eye, it causes mydriasis. So let's take a review about what we learned from today's. First MCQ is which one of the following is a ganglion blocking drugs? Hexamethonium. Second, Botulinum toxin produces skeletal muscle paralysis by inhibiting release of acetylcholine. Ganglion blocking drugs are used for the following emergencies except cardiovascular collapse. Next, which one of the following agent is a short-acting ganglion blocker? Trimethophan. The systemic effect of hexamethonium includes all of the following except stimulation of thermoregulatory sweating. Thank you all of you for your attention.